Hello, my name is Natalie Lyster, and I did the introduction portion of the PICO poster. Originally, our group began research by selecting the population, which is cancer patients, and the problem, which is pain control. We started by looking at many types of alternative therapies to control pain, but the one that stuck out to us the most and seemed extremely promising was acupuncture. There is a significant amount of research on this topic, and it has been utilized for thousands of years. Ultimately, as a group, we developed a PICO question, which posed the question of, in cancer patients, how does acupuncture, in combination with normal therapies, compared to normal therapies alone, work to relieve pain? We know that acupuncture is a great choice, and that it helps many individuals with various diseases, but we wanted to dig deeper to see if this type of therapy actually gave satisfactory levels of pain control for cancer patients. Acupuncture is a form of treatment which utilizes the application of needles, heat, and pressure to various places on the skin called acupuncture points. Traditional Chinese medicine describes disease as causing disruptions to the flow of energy in the body. The pros of acupuncture treatment greatly outweigh the cons. The side effects that can occur are minimal and include things such as fatigue, bruising, soreness, and lightheadedness. Acupuncture is a minimally invasive therapy which has been a key component in Chinese medicine for a long time. This therapy can also influence the holistic well-being of patients and assist with stress management. Additionally, this type of therapy currently has no age restrictions. Another extremely important part of utilizing alternative therapies is that it can reduce the consumption of opioids. Many people want a holistic approach but feel that is unrealistic with the amount of pain that they experience. Cancer patients often have limited options when it comes to pain control, which is why we decided to look into what alternative therapies can do for them. Lastly, using alternative pain therapies puts the choice back in the hands of the patient. Cancer takes away so much from a patient, and many treatments don't offer customizable choices. Using alternative pain therapy allows a patient to experiment with what works for them, how often they want to participate, and more.
Hello, my name is Devon Klein, and I am a nursing student here at Mercy College. The prevalence of cancer is high and is among one of the leading causes of death, according to the National Cancer Institute. With cancer comes pain. Approximately 90% of individuals with advanced cancer have moderate to severe pain, with 70% of patients not receiving adequate pain relief from therapy. Pain is said to be the fifth vital sign and can be classified as physical, emotional, or spiritual. Many patients take pharmacologic measures to alleviate the pain that cancer causes them. But while cancer prevalence is high, so is opioid dependence. Narcotic medication is highly addictive, and the chances of overdosing on these drugs is high. This is where alternative therapy comes into play. Acupuncture is a non-pharmacologic method used for treating a variety of conditions, including pain. Acupuncture is performed by a licensed practitioner who meticulously places needles into the patient's skin, specifically at what's called acupressure points. The needle placement is supposed to stimulate points in the body to promote a feeling of numbness, tingling, aching, or heaviness. This releases Qi through channels or meridians in the body. Qi is defined by traditional Chinese medicine as a disruption to the flow of energy. In the article, randomized, blinded, sham-controlled trial of acupuncture for the management of aromatase inhibitor-associated joint symptoms in women with early-stage breast cancer. The pain-relieving properties of acupuncture may be mediated by the release of neurotransmitters. While there are many theories as to why acupuncture works, the most important thing is that it is effective in relieving pain. And since it is a conservative treatment, it is safe to use on everybody and is easily accessible since there is no prescription or referral needed from a doctor. According to Fan et al., Acupuncture's cost effectiveness can dramatically decrease health care expenditures, both from the standpoint of treating acute pain and through avoiding addiction to opioids that requires costly care, destroys quality of life, and can lead to fatal overdose. Some insurance companies require or recommend physicians to offer conservative treatment, such as acupuncture, before they will consider reimbursement for pharmacological treatment for pain. Medical professionals, including nurses, can potentially help improve a patient's overall quality of life by offering alternative or adjunctive therapies, such as acupuncture, which would ultimately reduce the number of times they come in for treatment related to pain, driving down costs.
Hi, I'm Teagan. I'm going to be talking about the literature review section of our poster. We found many articles related to our PICO question, but I chose just a few that pertain the most to our PICO question. So Valos and Asprey completed a qualitative study, level 6, to 23 patients who had upper body lymphedema. Focus groups were completed in a 3-month period, and each participant completed at least 7 treatments of acupuncture and were invited by letter to participate. These were mainly females with varied demographic backgrounds, and most of them had breast cancer. The participants reported improved energy and mobility, better quality of sleep, and reduced pain, which overall improved their well-being. This related to our PICO question because it shows that acupuncture is a helpful alternative therapy to cancer pain by improving the patient's quality of life. Another study done by Zhao was a randomized control study, level 2 with 56 patients ages 40 to 70, and they were men and women. They also had varying demographics. They all had gastric cancer receiving chemotherapy at the time. They were divided into 2 groups, one being the control group and one being the experimental group. The experimental group then received 30 minutes of acupuncture daily for 2 weeks. They compared nausea, vomiting, diarrhea, abdominal pain, and then the cost of their hospitalization. The results showed improvement in nausea, vomiting, and abdominal pain, along with the improvement of quality of life. I also read that since they were using acupuncture, it helped reduce the cost of their hospitalization and medical bills. This relates to our PICO question because it shows acupuncture helping with the side effects of chemotherapy for cancer patients, helping to reduce their pain. Some methods that we used for our online databases were Google Scholar, PubMed, and the Academic Search Elite through Mercy College Library and their online site. Our search terms were mainly cancer, pain, alternative therapies, and acupuncture. Some limitations that we found in our articles were that the patients were using other forms of treatment to get rid of the pain associated with cancer along with the acupuncture. So that could have skewed the results a little bit. And another one was the sample sizes are very small, and that could have also affected the results and lessened the experiences of the patients in each group.
Hi, my name is Catie, and I'm going to be talking about the implications section of our poster. I'm just going to talk about the evidence that we found in our research throughout the semester. As Teagan brought up in the study from Devon in 2016, the use of acupuncture was found to improve the well-being for cancer patients suffering with lymphedema, as well as in the study from Zhao in 2017, the use of acupuncture was found to decrease the negative side effects associated with chemotherapy. All of this evidence suggests that the use of acupuncture can provide real-life benefits for our population of cancer patients. These evidential findings do indeed support the outcome aspect of our PICO question. In a study from Zhang in 2010, some important nursing implications were brought up. I found in that study that acupuncture can be used as an alternative treatment alone for cancer patients, but is also very beneficial when used in conjunction with common treatment. I think that taking these implications as we go forth into our nursing practice can remind us to really put the patient's preference first in their cancer treatment options, which allows us to provide more patient-centered care. In an article from Tracy Wyatt in 2019, the 5 basic phases of all EPB models are listed as ask, attain, appraise, apply, and assess. At the beginning of the semester, we met the basic phase of ask by identifying cancer pain as a problem. We then attained relevant literature through our literature review process. We then ensured that the evidence from our literature was clinically appraised. We applied the evidence into ways that we as nurses could offer patient-centered care, and we assessed the evidence by evaluating the outcomes, ensuring that the patients were indeed benefiting from the acupuncture.
Hi, I'm Lexi, and I will be recapping and concluding our PICO poster. Cancer is so prevalent in today's world, and as mentioned earlier in the presentation, about 1,735,350 new cancer diagnoses will be made within the year. One of the most prevalent symptoms in these patients is cancer pain, and it often goes untreated, according to Liu and Rosenthal. There needs to be something done to improve the pain these patients are experiencing. As shown throughout the poster, there's a lot of evidence stating acupuncture is a good pain management strategy when combined with traditional therapies, compared to patients just using traditional medication and therapies alone. The best examples include an article by Devon and Asprey, as well as one by Zohu, which were discussed earlier by Teagan. Both of these articles do a great job of supporting the idea that cancer pain can be better managed by utilizing alternative therapies. Patients in the study done by Devon and Asprey reported improved well-being and reduced medication use. Because of findings like these, it is indicated that there is a need for acupuncture and alternative therapy for pain management because of the evidence that shows it does seem to work. Overall quality of life for these patients is greatly improved in more ways than one, which is one of the reasons why this topic is on the rise in nursing practice. It is significant to nursing because it improves the lives of patients and their overall quality of life. Nurses would be able to better provide patient-centered care to their patients by utilizing alternative pain management methods. Alternative therapies being offered to cancer patients is something that can definitely be implemented. This is shown through several different articles. I think one article that demonstrates this well is the study done by Zohu in 2017. Acupuncture was implemented into the trial with ease, and patients reaped the benefits. The one issue that can be foreseen as a problem when implementing this therapy is the idea of funding. Details of who should fund this type of therapy will need to be further sorted out. Because of the high prevalence of cancer and the pain that goes untreated, acupuncture is a therapy that needs to be implemented in the plan of care. Evidence points to the idea that there are minimal negatives associated with acupuncture and many benefits. Patients utilizing this option are more likely to report an improved quality of life and a lower pain rating. Alternative therapies, along with the use of traditional therapies, are a good way to improve cancer-related pain. However, there is still more research that needs to be done to fully implement this plan of care.